Hi there, I'm Sandra Graham. I'm the RN Clinical Educator for Maternal Child Care Unit here at Prince County Hospital. SimBaby here is one of our newest members of our education equipment and has become a really wonderful tool for helping nurses and physicians to improve the care of really sick children that often come to our emergency department and our pediatrics ward. We want to try to simulate really sometimes rare but really emergency-like scenarios so that when these scenarios actually happen in real life, that we're really well equipped and that the team is ready to deal with them effectively. So SimBaby, like the other high fidelity simulation mannequins that we have here at Prince County Hospital, can simulate all kinds of real life situations. They can open their eyes, their pupils are responsive whenever we're checking that. They can move, they breathe, they have breath sounds that sound quite realistic. We can start an IV in their hand. We can actually insert a chest tube or a needle into their chest if they had some pneumothorax. They have real fontanelles that can fill up. We can actually put a breathing tube in this baby if need be. We can simulate capillary refill, which has to do with how well they're perfusing the rest of their body or how their tissues are being oxygenated. They have real vital signs, and so when we hook them up, it's actually wirelessly to this monitor, we're able to get information as well. If I want to change something, I use this little iPad so that I can change the scenario as the students or the learners are assessing the child. So they have real life assessments that are related to what is going on in the scenario, and they actually have to figure out not only what's happening, but how they're going to fix it. So in a moment, we're going to simulate one of those types of scenarios where a baby with pretty normal vital signs, all of a sudden things get worse, and the learners would have to try to figure out what's happening and very quickly intervene in order to care for the baby safely and effectively. All right, Katie, so we're looking after this 10-month-old. He came into the emergency department with seizing, and they were able to stop the seizures with medication. But we want to make sure we do our assessments and we'd be looking out for any kind of seizure activity. Right now, he looks pretty good. He's moving around. His chest sounded good. He's reacting to us. He's blinking his eyes a little bit. Color looks good. Vital signs are good here, according to the monitor. So everything's looking pretty good so far.
Right.
But we have to be ready for anything. And oh gosh, I think we're actually seeing him starting to seize. And one of the things that we want to make sure we're looking after is the airway first, and might need a bit of suction. Keep him safe.
On.
His oxygen level is going down there, Katie, too. His O2 sat is in about 69 to 70. I wonder if we can apply some oxygen. Meredith, can you please call the doctor and also get someone else to prepare some medication for the baby because he is having a seizure right now. We need some help.
And suction, oxygen on.
Good job. All right. Looks like the seizing has stopped actually. Oxygen level is going up, so that's good.
Color's improving.
We should probably check a blood pressure too. O2 sats continue to go up. Good job. Oxygen level's gone up quite nicely, so we can probably even take it off, do you think?
I think so.
Does he need any more suctioning? I think he's doing okay.
Looks good.
And his breathing is getting back to normal too. His respiratory rate's starting to go up there, I see. I'm going to check another blood pressure now that we've given a bit more fluid. Starting to blink a little bit. He's a bit more reactive, so that's good. Blood pressure is
looking better.
definitely better. We'll check his cap refill and other perfusion symptoms to make sure that he's doing okay in that way as well. And we probably want to make sure that we have some medication ready to give if it happens again. Another simulator we're hoping to see in the near future is a pregnant mother simulator, where labor and birth is simulated, as well as some of the emergency events that can happen along with that. We want to make sure that our team is very well prepared for those types of scenarios so that the mothers and the babies can get the very best care when they need it. I'd like to give a sincere thank you for the donors to the Prince County Hospital Foundation for helping to make purchases like this a reality. Being able to do high fidelity simulation in all kinds of types of scenarios and all different kinds of patients makes a huge difference for the staff and the patients in our area. Thank you so much.